It is a report with a difference. It celebrates the contributions that communities of people living with HIV, key populations and civil society organisations have made to the response to HIV from the very beginning. But the report also makes the case for countries to do more, to centre, to fund and facilitate the work of the communities. Why? Because community-led organisations deliver the results that no other entity can. Their leadership is crucial in reaching the people being left behind. Countries that have made the biggest advances and the greatest impact in responding to the HIV epidemics are those who have worked with the communities at the centre. Most of you are aware of the global AIDS strategy targets relating to HIV services and societal enablers. The 95 goals push us collectively to achieve, for all relevant populations, 95% coverage of combination prevention, HIV testing, treatment and viral suppression, services for eliminating mother-to-child transmission or vertical transmission, and sexual and reproductive health services. The 10-10-10 targets call on us to ensure that less than 10% of countries have punitive laws and policies. Less than 10% of people living with HIV and key populations experience stigma and discrimination. And less than 10% of women, girls and key populations experience gender inequality and violence. These 10-10-10 targets are for part of the political declaration of 2021 that member states agreed to, and yet they're a long way from achieving these targets. As the report mentions, in many places, the law reform work is being spearheaded by communities. This year, the Cook Islands Parliament in the Pacific decriminalised consensual sex between men, thanks to the strategic advocacy of Pride Cook Islands and Te Tiare Association. Communities have also headed legal challenges to discriminatory laws, some going back many, many years. This includes in India, where in 2018, the Supreme Court struck down Section 377 of the Penal Code, which prohibited sex between men, a law that is in many different countries across our region or adapted in their legal codes. So it's a landmark change that community spearheaded that we should see other countries follow. A key dimension of this work is access to justice. The report cites the example of street law, PH, in the Philippines, which trains people who use drugs and are in prisons to act as jail paralegals. A lot of people are on many years in jails in the Philippines for many years on remand without sentence. And so the paralegals have a really important role to help them. They help navigate cases through the justice system and document concerns around access to justice. The 10-10-10 targets recognize a truth that we have long understood around HIV. It's not just a health issue, and it is not addressed merely by providing health services. We must break down the structural barriers, blocking the full enjoyment of human rights, gender equality, and lives to be able to be lived free from abuse, injustice, or prejudice. But this World AIDS Day report also brings into sharp focus the 30, 80, 60 targets. Not enough of us in the AIDS response are steadily advocating for these goals, which specifically relate to community leadership. Through the 2021 political declaration on HIV and AIDS, governments have already promised to ensure that 1, community-led organisations will deliver 30% of testing and treatment services. This includes a focus on linkage to care, adherence and retention support, treatment and literacy, and of course, testing itself in all its forms. 2, community-led organisations should deliver 80% of HIV prevention services in the community for people from key populations at high risk of infection. So that's important to keep in mind. 80% of prevention services they've committed to being led by the community. And finally, 3, community-led organisations should deliver 60% of programs to support the achievement of the societal enablers. We're a long way from that, and we're going to hear from colleagues across the region with their lived experience. These targets are not inferior, of course, to the 95s or the 10s. In fact, they are absolutely essential to unleashing the true potential of the powerful HIV prevention and treatment services that we now have at our disposal. Many advances, but they're being held back because of the lack of focus on the role of the community. This year's report calls for policymakers to recognize and support community leadership. Unfortunately, in many places, the work of communities, as Pia said in her opening remarks, is under-supported, under-resourced. People are under-remunerated, not paid adequately for the work they do, and even under attack. The report shares new UNAIDS financial estimate findings that funding to communities has declined sharply, as you can see on the screen. This is the clearest indicator that the world is not making good on its commitment to prioritize community leadership in the AIDS response. Over the last decade, we've seen a reduction of the HIV resources, that's all forms of resources, going to community-led organizations. Globally in 2012, around 1/3 of all HIV funding was channeled through community-led organizations. Now in 2021, that's reduced to just 20%. To give some regional perspective, I'd like to share some Asia-Pacific data. This graph shows that there is an inadequate investment in key population HIV prevention programs. The green lines represent the key population prevention spending, most of which should be implemented by key population-led organizations. But in every single country, these investments are inadequate to the need, despite the commitments made by the countries to the political declaration, both domestic and international resources. But what is the need? Here in Asia Pacific, 95% or 96% now of new infections are among key populations and their sexual partners. More than any other region, it is imperative that the vast majority of our HIV prevention funding is channeled through key population-led organizations best placed to reach those most at risk. Think of the environment people are living in today. Many of them are not accessing services that were available and more open to the communities in the past. So they need to be able to access these in ways that they feel safe. So we need community-led organizations, key pop-led organizations to be at the forefront. And as you can see, almost half of the new infections are among men who have sex with men. Therefore, funding to MSM and LGBT-led organizations should reflect this, but it doesn't. Of particular concern for Asia Pacific is the rising epidemic among men who have sex with men in several countries and across the region as a whole, and the slow decline in others. These are, here on the graph, 6 countries from the region. If you focus just on the dark green line, it represents the trend in new infections among MSM. You can see that it is either rising or fairly flat. You can also observe that the faster downward trend and lower rates of infections among other population groups. So there's a mismatch in where the resources are being used and the types of programs that are needed to be implemented. In Cambodia, Indonesia, Myanmar, Lao PDR, the Philippines and Thailand, youth from key population communities aged between 15 to 24 make up around half of the estimated new infections. Do the programs match that? And since 2010, new infections in the ages 15 to 24 have risen in Afghanistan, Bangladesh, Fiji, Papua New Guinea, and the Philippines. And when you look at these countries, these are the countries with the fastest growing epidemics in the region. And so there's no programmatic link between where the focus is. And you can see on this slide, those same countries in red. Our reality is that HIV prevention progress for Asia Pacific has virtually stalled. Since 2010, there has been just a 14% reduction for the region as a whole. In places with rising epidemics, as you can see in the red, We need an urgent focus on concrete, population-specific interventions led by the communities themselves. These countries include Bangladesh, Afghanistan, Papua New Guinea, Fiji, and the Philippines. In other countries, we must also leverage the power of communities to accelerate the progress. As you can see in the green, many of these countries are not reducing new infections anywhere near fast enough to have the community protection needed. The report cites a 2022 study from Thailand, which shows that key population-led organizations are most effective for scaling up PrEP access. In the Philippines, peer-led demedicalized PrEP services have helped double enrollment. The work can be spearheaded at the local level as well. And in Vietnam, we now have a strong example of using social contracting to deliver community-led harm reduction, HIV testing and referral services for HIV treatment and methadone. So we know it can be done, but we're not seeing the scale of investment to achieve the results required. We need to unleash the full power of communities to improve our testing linkage to care and treatment retention, as well as viral suppression outcomes, as you can see from this graph. In 2022, 22% of people living with HIV in this region were unaware of their status. 35% of people living with HIV are not accessing treatment, and 38% of people have not achieved suppressed viral load. We need to reflect on what is holding people back. Why are they not accessing services that should be readily available? Communities are best placed to help us close these gaps. The report cites and refers to the contribution of community-led organizations to a fourfold increase in testing in China, for instance, including by driving demand through online tools. We know it can be done. We know how it can be done. It also speaks about the work of community organizations in countries like Myanmar to support treatment continuity in conflict-affected areas. As you can see in this next graph, several countries, significant proportions of people who have already been diagnosed are not on treatment. Community-led organizations can provide support for the linkage to care, the treatment literacy needed, and ultimately the treatment adherence. This includes peer-to-peer PLHIV services, in person or online, as the need is for the people most in need. Here also, I want to mention the importance of community-led monitoring. The report references the excellent regional strategic direction and capacity building spearheaded by the 7 Alliance, and we'll hear from them today. By creating a feedback loop between service users, health service providers, and policymakers, we can steadily improve HIV service offerings. But we must first commit to funding community-led monitoring and to implementing its recommendations. And the 7 Alliance is holding the second regional meeting on community-led monitoring in 2 weeks' time, and we're looking forward to the results of that. But we need to see the countries implement the recommendations and fully resource it at the scale required. The overarching message of this report is that we can end AIDS as a public health threat, with communities leading the way, as they have done in the most successful responses. There are 3 broad advocacy priorities. The first, communities must be at the center of the formulation, the budgeting, the implementation, and the monitoring and evaluation of all plans, policies, and programs that affect them and are designed or should be designed for them and with them. Secondly, community roles must be fully and sustainably funded, and people implementing community-led programs should be properly remunerated, paid at the right level, be they a peer educator or someone working in the office, the right level of funding and salary to support them. And 3, we must remove barriers to community leadership roles by ensuring that the civil society space is there and it's protecting the human rights of all people. One of the wonderful features of this year's World AIDS Day report, and what makes it different from the past, is that it includes 9 personal essays, powerful essays from community leaders across the world. I'm pleased to say that 2 of these are from our own region. Harry Prabowo from the APN Plus, who's the program manager of the Asian Pacific network of people living with HIV, writes on your behalf about the need for adequate, sustainable financing for community-led service delivery, community-led monitoring and advocacy. And Bhagya Lakshmi, who's the secretary of the Ashadaya Samithi, shares a personal story of finding her voice as a sex worker activist. Through political advocacy, Indian sex workers have gained a say in key policies that affect their lives today.